Question 1. A 68-year-old male complains of sudden onset of severe, tearing chest pain radiating to his back. He has a history of hypertension. His skin is pale and clammy, and his radial pulses are unequal. Which of the following conditions should the EMT most suspect? A. Myocardial infarction. B. Pneumothorax. C. Aortic dissection. D. Pericarditis. Answer: C. Aortic dissection. This question tests your ability to identify a critical cardiovascular emergency based on specific symptoms. The keywords sudden onset, severe, tearing chest pain, radiating to his back, and especially unequal radial pulses are classic indicators of an aortic dissection, where the inner layer of the aorta tears. Unlike a typical heart attack, which usually presents with crushing or squeezing pain, tearing pain with unequal pulses strongly suggests this life-threatening condition. For instance, if you encounter a patient with these specific symptoms, immediately suspect an aortic dissection and ensure rapid transport to a definitive care facility. Always remember that unequal pulses in the context of tearing chest pain are a red flag for aortic dissection. Question 2. When performing bag valve mask, BVM, ventilation on an adult patient with a pulse, what is the most appropriate ventilation rate? A. 20 to 24 breaths per minute. B. 10 to 12 breaths per minute. C. 6 to 8 breaths per minute. D. As fast as possible to improve oxygenation. Answer: B. 10 to 12 breaths per minute. This question focuses on appropriate ventilation rates during basic airway management. The crucial clue is adult patient with a pulse, indicating a patient who needs ventilatory support but is not in cardiac arrest. For adults, the recommended rate for BVM ventilation with a pulse is 1 breath every 5 to 6 seconds, which translates to 10 to 12 breaths per minute, ensuring adequate oxygenation without causing gastric inflation or barotrauma. Delivering breaths too quickly can actually hinder venous return and decrease cardiac output, while too slowly might not provide enough oxygen. Always aim for slow, deliberate breaths, just enough to cause visible chest rise. Question 3. A 25-year-old female presents with warm, flushed skin, a rapid and strong pulse, and a blood pressure of 80/40 mmHg. She is confused and has a fever of 103 degrees Fahrenheit 39.4 degrees Celsius. What type of shock is she most likely experiencing? A. Hypovolemic shock. B. Cardiogenic shock. C. Anaphylactic shock. D. Septic shock. Answer: D. Septic shock. This question tests your understanding of different types of shock and their unique presentations. The key indicators here are warm, flushed skin, rapid and strong pulse, which can become weak later, fever, and altered mental status, all pointing to a severe systemic infection. Unlike hypovolemic or cardiogenic shock, which typically present with cool, pale skin, septic shock often involves vasodilation early on, leading to warm skin. For example, if you encounter a patient with signs of infection combined with low blood pressure and altered mental status, suspect sepsis. Remember that not all shock presents with cool, clammy skin. Septic shock can be warm and flushed. Question 4. An unresponsive 30-year-old male is found with shallow, slow respirations at 6 breaths per minute. His pupils are pinpoint, and there are drug paraphernalia near him. The most appropriate initial medication to administer, if available and protocols allow, is A. Aspirin. B. Oral glucose. C. Naloxone. D. Activated charcoal. Answer: C. Naloxone. This question assesses your knowledge of medication administration for specific overdose presentations. The critical clues are shallow, slow respirations, pinpoint pupils, and the presence of drug paraphernalia, which strongly suggest an opioid overdose. Naloxone is an opioid antagonist that rapidly reverses the effects of opioids, particularly respiratory depression, making it the most appropriate and potentially life-saving intervention in this scenario. For example, if you suspect an opioid overdose based on these signs, administering naloxone intranasally or intramuscularly can quickly restore the patient's breathing. Always remember that naloxone is indicated for suspected opioid overdose with respiratory depression. Question 5. You are caring for a conscious and oriented adult patient who refuses transport to the hospital after a minor motor vehicle collision. What is the most critical action you must take before leaving the scene? A. Call medical direction for approval to release the patient. B. Have the patient sign an AMA, against medical advice, form. C. Contact law enforcement to force the patient to go to the hospital. D. Inform the patient that they will be responsible for all medical bills. Answer: B. Have the patient sign an AMA, against medical advice, form. This question evaluates your understanding of patient refusal and legal responsibilities. The key concept is respecting patient autonomy while ensuring you have documented their informed refusal. While calling medical direction for advice is good practice, the most critical step for documentation and legal protection is to have the patient sign an AMA form, after thoroughly explaining the risks of refusal and ensuring they are competent to make the decision. For instance, if a patient refuses care, you must explain the potential consequences of not going to the hospital and obtain a signed refusal to protect yourself and your service. Always document competency, risks explained, and the patient's decision clearly. Question 6. A patient who sustained a blow to the head displays Cushing's triad. Which of the following sets of vital signs characterizes Cushing's triad? A. Hypotension, tachycardia, irregular respirations. B. Hypertension, bradycardia, irregular respirations. C. Hypotension, bradycardia, rapid respirations. D. Hypertension, tachycardia, rapid respirations. Answer: B. Hypertension, bradycardia, irregular respirations. This question tests your knowledge of critical signs of increased intracranial pressure, ICP, following a head injury. Cushing's triad is a classic indicator of severe brain compression. It consists of 3 specific vital sign changes: increased blood pressure, hypertension, decreased heart rate, bradycardia, and an abnormal respiratory pattern, irregular respirations. These signs represent the body's attempt to maintain cerebral perfusion in the face of rising ICP. For example, if you observe a patient with a head injury developing these specific vital signs, it signals a rapidly worsening condition requiring immediate attention and transport. Recognizing Cushing's triad is vital for identifying life-threatening brain injury. Question 7. A 45-year-old diabetic patient presents with warm, dry skin, polyuria, polydipsia, and polyphagia. She is alert but confused. Her blood glucose reading is 580 milligrams per deciliter. What is the most likely underlying condition? A. Hypoglycemia. B. Diabetic ketoacidosis, DKA. C. Insulin shock. D. Allergic reaction. Answer: B. Diabetic ketoacidosis, DKA. This question assesses your ability to differentiate between diabetic emergencies. The key indicators are warm, dry skin, the 3 Ps, polyuria, polydipsia, polyphagia, altered mental status, and a very high blood glucose reading, 580 milligrams per deciliter. These symptoms, especially in a diabetic patient, are classic signs of diabetic ketoacidosis, DKA, which occurs when the body produces high levels of blood acids called ketones. Hypoglycemia, in contrast, would present with cool, clammy skin and a low blood glucose. For example, if you find a diabetic patient with these symptoms, including a fruity odor on their breath, from ketones, suspect DKA. Remember that high blood sugar with warm, dry skin and excessive thirst and urination often points to DKA. Question 8. During adult cardiopulmonary resuscitation, CPR, what is the recommended compression depth? A. At least 1 inch 2.5 centimeters. B. At least 2 inches 5 centimeters. C. No more than 1.5 inches 3.8 centimeters. D. No more than 2.4 inches 6 centimeters. Answer: B. At least 2 inches 5 centimeters. This question focuses on high-quality CPR guidelines, reflecting current standards. For effective adult CPR, the recommended compression depth is at least 2 inches 5 centimeters but no more than 2.4 inches 6 centimeters to ensure adequate blood flow to vital organs. Compressing less than 2 inches is ineffective, while excessively deep compressions can cause injury. For instance, when performing chest compressions, imagine trying to push the sternum down about 2 fingers width. Always strive for consistent, deep compressions to maximize the chances of successful resuscitation. Question 9. A 7-year-old child presents with a sudden onset of barking cough, stridor, and difficulty breathing, with a history of recent upper respiratory infection. There is no fever. What is the most likely diagnosis? A. Epiglottitis. B. Bronchiolitis. C. Croup. D. Asthma exacerbation. Answer: C. Croup. This question tests your ability to identify common pediatric respiratory emergencies. The critical clues are barking cough, stridor, a high-pitched whistling sound on inspiration, and a history of a recent upper respiratory infection, all classic signs of croup, laryngotracheobronchitis, which causes swelling around the vocal cords and trachea. Epiglottitis, while serious, typically presents with high fever and drooling, without a barking cough. For example, if you hear a child making a sound like a seal barking, especially at night, think croup. Remember that the distinctive barking cough and stridor are hallmarks of croup. Question 10. You are performing a primary assessment on an unresponsive patient. After ensuring scene safety and opening the airway, what is your immediate next step? A. Obtain a full set of vital signs. B. Check for a carotid pulse. C. Administer high-flow oxygen. D. Perform a rapid body scan for injuries. Answer: B. Check for a carotid pulse. This question assesses the sequential steps of the primary assessment in an unresponsive patient. After establishing scene safety and opening the airway, the immediate next step is to assess circulation by checking for a pulse to determine if the patient is in cardiac arrest or has inadequate circulation. This is crucial because if no pulse is present, CPR must be initiated without delay. For instance, in an unresponsive patient, you'd quickly look, listen, and feel for breathing, then immediately check for a carotid pulse on the side closest to you. Always remember the ABCs: airway, breathing, circulation, in that critical order. Question 11. Which of the following signs is most indicative of a suspected stroke? A. Sudden onset of crushing chest pain. B. Unilateral facial droop and speech difficulties. C. Gradual onset of shortness of breath. D. Generalized tonic-clonic seizure activity. Answer: B. Unilateral facial droop and speech difficulties. This question evaluates your recognition of common stroke symptoms. The keywords unilateral facial droop and speech difficulties are classic and highly indicative signs of a stroke, which occurs when blood flow to a part of the brain is interrupted. These symptoms are part of the common FAST assessment: face drooping, arm weakness, speech difficulty, time to call 911. While seizures can occur with stroke, these specific focal neurological deficits are more direct indicators of acute brain ischemia or hemorrhage. For example, If a patient suddenly cannot smile evenly or their words are slurred, immediately suspect a stroke. Always remember that neurological deficits appearing suddenly are a strong sign of stroke. Question 12. You are assisting in a field delivery. After the head delivers, you notice the umbilical cord is wrapped around the baby's neck. What is your immediate priority? A. Pull gently on the umbilical cord to free it. B. Clamp and cut the cord immediately. C. Attempt to slip the cord over the baby's head or shoulders. D. Wait for the body to deliver and then address the cord. Answer: C. Attempt to slip the cord over the baby's head or shoulders. This question tests your knowledge of managing a nuchal cord during delivery. The immediate priority is to free the cord from around the baby's neck to prevent compression and compromised blood flow. The safest method is to attempt to gently slip the cord over the baby's head or shoulders. Only if this is not possible and the cord is tight would you consider clamping and cutting the cord as a last resort, after consulting medical direction. For example, if you see the cord around the neck as the head delivers, gently try to unwrap it like you would a necklace. Always prioritize relieving the pressure on the cord to ensure blood flow to the baby. Question 13. A 30-year-old construction worker is found unresponsive with hot, red, dry skin and a core body temperature of 105 degrees Fahrenheit 40.6 degrees Celsius. He is no longer sweating. What is the most appropriate initial intervention? A. Administer oral rehydration fluids. B. Apply cold packs to the groin, armpits, and neck. C. Provide warm blankets to prevent hypothermia. D. Encourage physical activity to promote sweating. Answer: B. Apply cold packs to the groin, armpits, and neck. This question describes a classic presentation of heat stroke, a life-threatening emergency. The critical clues are unresponsive, hot, red, dry skin, no longer sweating, and a very high core body temperature. The immediate priority for heat stroke is rapid cooling to prevent further organ damage. Applying cold packs to areas with large superficial blood vessels, like the groin, armpits, and neck, is an effective way to quickly lower core temperature. Oral fluids are inappropriate for an unresponsive patient, and warming him would be detrimental. Always remember that heat stroke requires immediate and aggressive cooling measures. Question 14. When performing a secondary assessment on a stable medical patient, what is the best order of assessment? A. Head-to-toe examination, then sample history. B. Chief complaint, then vital signs, then physical exam. C. Sample history, then OPQRST for pain, then focused physical exam. D. Vital signs, then focused physical exam, then sample history. Answer: C. Sample history, then OPQRST for pain, then focused physical exam. This question focuses on the appropriate sequence for a secondary assessment in a stable medical patient. The primary goal is to gather detailed information. After the primary assessment, obtaining a thorough sample history, signs/symptoms, allergies, medications, past medical history, last oral intake, events leading to current illness/injury, and using OPQRST, onset, provocation, quality, radiation, severity, time, for any pain or discomfort is crucial. This helps guide your focused physical exam to areas relevant to the chief complaint. For example, if a patient complains of abdominal pain, you'd ask the sample/OPQRST questions first, then perform a focused exam of the abdomen. Always gather a good history before performing a detailed physical exam on a stable medical patient. Question 15. What is the maximum recommended duration for suctioning an adult patient's airway at one time? A. 30 seconds. B. 20 seconds. C. 15 seconds. D. 10 seconds. Answer: D. 10 seconds. This question addresses the critical safety aspect of airway suctioning. The maximum recommended duration for suctioning an adult patient's airway at one time is 10 seconds. Suctioning removes oxygen from the airway along with secretions, so prolonged suctioning can lead to hypoxemia, low blood oxygen levels, and bradycardia, slow heart rate. For example, if you need to suction for longer, take a break after 10 seconds, oxygenate the patient, and then suction again if necessary. Always remember to limit suctioning to brief periods to minimize patient hypoxia. Question 16. A patient is experiencing a severe anaphylactic reaction. They are hypotensive, tachycardic, and have severe dyspnea with widespread urticaria. The most appropriate initial medication, if protocols allow, is A. Oral antihistamine. B. Albuterol by nebulizer. C. Epinephrine. D. Dexamethasone. Answer: C. Epinephrine. This question tests your knowledge of managing severe allergic reactions. The key indicators of a severe, life-threatening anaphylactic reaction are hypotension, tachycardia, severe dyspnea, and widespread urticaria, hives. Epinephrine is the drug of choice for anaphylaxis because it rapidly counteracts the systemic effects, including vasoconstriction, to raise blood pressure, bronchodilation, to ease breathing, and reduction of swelling. While antihistamines and bronchodilators may be used as adjuncts, they are not sufficient for severe anaphylaxis. For example, if a patient presents with rapidly worsening allergic symptoms affecting their airway or circulation, epinephrine should be administered immediately. Always remember that epinephrine is the frontline treatment for severe anaphylaxis. Question 17. Upon arriving at the scene of a motor vehicle collision, your first priority as an EMT is to A. Immediately access and begin treating the most critical patient. B. Establish incident command and request additional resources. C. Ensure scene safety for yourself, your crew, and bystanders. D. Begin triaging all patients to determine injury severity. Answer: C. Ensure scene safety for yourself, your crew, and bystanders. This question emphasizes the paramount importance of scene safety in EMS operations. Before any patient contact or treatment begins, the absolute first priority is to assess and ensure the safety of the scene for yourself, your crew, and any bystanders. This includes evaluating traffic hazards, unstable vehicles, spilled fuels, or other dangers that could harm rescuers or patients. For example, before approaching a crashed car, you would check for leaking fluids, downed power lines, or active traffic. Always prioritize your safety and the safety of others before you can effectively help any patient. Question 18. When assessing a pediatric patient, which finding is generally considered a late and ominous sign of respiratory distress? A. Nasal flaring. B. Retractions. C. Grunting. D. Cyanosis. Answer: D. Cyanosis. This question focuses on recognizing severe respiratory distress in pediatric patients. While nasal flaring, retractions, pulling in of the skin between ribs, above clavicles, or below the sternum, and grunting are all signs of respiratory distress, cyanosis, a bluish discoloration of the skin or mucous membranes, is a late and very ominous sign. It indicates that the body is severely deprived of oxygen and suggests impending respiratory failure. For example, if a child who was previously only retracting now has blue lips, it means their condition is rapidly worsening and requires immediate aggressive intervention. Always remember that cyanosis in a child is a sign of severe hypoxemia. Question 19. For a patient with severe external arterial bleeding from an extremity that is not controlled by direct pressure, what is the next most appropriate intervention? A. Apply a tourniquet proximal to the injury. B. Elevate the injured extremity above the heart. C. Apply a pressure point distal to the injury. D. Apply ice packs to the bleeding site. Answer: A. Apply a tourniquet proximal to the injury. This question tests your knowledge of managing severe, uncontrolled external hemorrhage. The critical clue is not controlled by direct pressure, indicating a life-threatening bleed. When direct pressure is insufficient, applying a tourniquet proximal, closer to the body's core, to the injury is the most effective and often life-saving intervention for severe arterial bleeding on an extremity. Elevation and pressure points are less effective for uncontrolled arterial bleeding, and ice packs are not sufficient. For example, if direct pressure on a severely bleeding arm wound isn't stopping the flow, immediately apply a tourniquet high and tight on the arm. Always remember that a tourniquet is a definitive intervention for severe, uncontrolled extremity hemorrhage. Question 20. Which of the following is an example of objective patient information? A. Patient states he feels like he is having a heart attack. B. Patient appears anxious and in severe pain. C. Patient's blood pressure is 140/90 mmHg. D. Patient reports feeling nauseated. Answer: C. Patient's blood pressure is 140/90 mmHg. This question clarifies the distinction between subjective and objective patient information, which is crucial for accurate documentation. Objective information is factual, measurable, and observable by the EMT, free from personal opinion or interpretation. A blood pressure reading of 140/90 mmHg is a quantifiable, objective vital sign. Statements about how the patient feels, how they appear, or what they report are subjective, reflecting their perception or your interpretation. For instance, documenting patient had bilateral lung sounds clear is objective, whereas patient seemed to breathe better after oxygen is subjective. Always strive to document objective data, as it provides undeniable facts about the patient's condition. Question 21. The epiglottis functions to: A. Produce sounds for speech. B. Warm and humidify inhaled air. C. Prevent food and liquid from entering the trachea. D. Filter foreign particles from the air. Answer: C. Prevent food and liquid from entering the trachea. This question assesses your understanding of basic airway anatomy and physiology. The epiglottis is a leaf-shaped flap of cartilage located at the base of the tongue, which acts as a lid for the larynx, voice box. Its primary function is to fold down over the glottis during swallowing, preventing food and liquids from entering the trachea, windpipe, and lungs. This protective mechanism is vital to prevent aspiration. For example, without a properly functioning epiglottis, every swallow would lead to choking or aspiration pneumonia. Always remember the epiglottis protects your airway from foreign invaders like food and drink. Question 22. When communicating with an elderly patient who may have hearing loss, the most effective strategy is to: A. Speak very loudly and quickly to ensure they hear you. B. Shout your questions from a distance to avoid startling them. C. Speak clearly and distinctly, at a moderate pace, directly facing them. D. Write down all questions for them to read. Answer: C. Speak clearly and distinctly, at a moderate pace, directly facing them. This question focuses on effective communication techniques, especially with vulnerable populations. For patients with potential hearing loss, speaking clearly and distinctly, at a moderate pace, and directly facing them allows them to better hear your words and potentially read your lips. Speaking too loudly can distort sounds, and speaking too quickly or from a distance makes comprehension difficult. For instance, if you suspect hearing loss, get to the patient's eye level, reduce background noise, and ensure they can see your mouth as you speak. Always adapt your communication style to the patient's needs to ensure understanding and build rapport. Question 23. A 55-year-old male complains of sudden, crushing chest pain that radiates to his left arm and jaw. He is pale, diaphoretic, and nauseated. What is the most likely cardiac event occurring? A. Angina pectoris. B. Myocardial infarction. C. Congestive heart failure. D. Aortic aneurysm. Answer: B. Myocardial infarction. This question tests your ability to recognize the classic signs and symptoms of a heart attack. The keywords sudden, crushing chest pain, radiates to his left arm and jaw, and associated symptoms like pale, diaphoretic, sweaty, and nauseated are highly indicative of a myocardial infarction, heart attack, where blood flow to a part of the heart muscle is blocked. Angina pain is usually relieved by rest or nitroglycerin, and symptoms of congestive heart failure are primarily respiratory. For example, if a patient presents with these symptoms, immediately suspect a heart attack and initiate appropriate cardiac protocols and rapid transport. Always remember that chest pain radiating to the arm and jaw, especially with sweating and nausea, signals a possible heart attack. Question 24. During vehicle extrication, after stabilizing the vehicle and addressing immediate hazards, what is the next priority before gaining access to the patient? A. Rapidly remove the patient from the vehicle. B. Perform a detailed patient assessment. C. Protect the patient and rescuers from glass and sharp edges. D. Apply a cervical collar to the patient. Answer: C. Protect the patient and rescuers from glass and sharp edges. This question addresses a crucial step in vehicle extrication. After ensuring the vehicle is stable and obvious hazards are controlled, the next priority before attempting to gain access or perform a detailed assessment is to protect the patient and rescuers from potential injuries from broken glass, sharp metal edges, or other debris. This involves covering the patient with blankets or tarps and ensuring rescuers are wearing appropriate personal protective equipment. For instance, before cutting roof posts, you'd cover the patient to prevent glass shards from falling on them. Always ensure patient and rescuer safety from environmental hazards before proceeding with extrication. Question 25. An elderly patient is found disoriented and confused by family members. They report the patient has not been acting normally for the past 24 hours. The patient has a history of diabetes and hypertension. What is the most important initial assessment to perform related to altered mental status? A. Detailed neurological exam including cranial nerves. B. Assessment for signs of head trauma. C. Blood glucose level check. D. Comprehensive medication reconciliation. Answer: C. Blood glucose level check. This question highlights the importance of a rapid, critical assessment for altered mental status, especially in patients with pre-existing conditions. Given the patient's disoriented and confused state and history of diabetes, checking the blood glucose level is the single most important and rapid initial assessment. Both extremely high, hyperglycemia, and low, hypoglycemia, blood glucose levels can cause profound altered mental status and are often treatable in the field. While other assessments are important, a blood glucose check can quickly identify a reversible cause. For example, if an elderly diabetic patient is confused, checking their blood sugar can immediately tell you if they are critically low and need glucose. Always rule out hypoglycemia as a cause of altered mental status, especially in diabetics.